Hi, I'm Shakira Tillery. I'm recording my Triple P video, and now we're going to start with Competency 1. Hi, Ms. Hayes. How are you doing today?
Good, how are you?
Good. All right, so during this session today, we're going to kind of just review what we did in our initial interview.
Okay.
And we're going to go over the assessments that you completed, as well as the behavior monitoring tool I provided you with, and kind of talk about the observation that was conducted.
Okay.
All right. So in the initial interview, we were talking about some of Angel's behaviors that you've been seeing recently. And basically, you were telling me that he's having multiple tantrums throughout the day and sometimes can get violent, kind of can kick things and throw things and just not compliant when you're giving him instructions. You also stated this happens maybe 2 to 5 times a day. Is that still happening for you?
Yeah, it is a lot. Yeah.
And so you mentioned that, what you would like to get out of this program is kind of like identifying his triggers and kind of limiting his tantrums to maybe about 2 times a day.
Yeah, that would be good because sometimes, like, depending on the day, it can be over 5 times, and it just, I don't know how to respond anymore.
Okay.
Yeah.
Great. And Triple P can definitely help you with some skills to learn how to set limits and kind of encourage some desirable behaviors.
Okay.
All right. So first, I want to start off with going over our assessments that we did. The first one you did was the ECBI, which measures the frequency of problems and how you react to them. And if you remember, it's the sheet that was give you a behavior and you kind of rate the frequency of it and then identify if it's a problem or not for you.
Mm-hmm.
All right.
Yeah.
So that shows that he does have pretty frequent behaviors, and his behaviors are normal for a child his age, but he's doing it. The frequency of it is more normal than your average child in the clinical range.
Okay.
So it's not severe, but it's something that is concerning, and that's something that we could possibly work on.
Okay.
Sounds good for you?
Yeah. Yeah.
So the next assessment that you did was the parenting scale, and the parenting scale measures how you respond and react to certain behaviors or other situations. So with that, it kind of shows that you give him multiple redirections over and over again, and eventually you just kind of get more lax and you just give in to him and just either complete what needs to be done or kind of give him something to kind of stop the tantruming.
Yeah. Yeah, I feel like I used to be, like, more, I guess, have more follow through, but yeah, now that you say that, that's true. Like, I just kind of, depending on how many tantrums he's had, like, I just let stuff go now. Yeah.
All right, great. So thank you for your feedback as well. And also last session, I provided you with a behavior monitoring tool, and I actually gave you the tally sheet,
Mm-hmm.
and we decided that that you would kind of monitor the tantrums that he has throughout the day.
Yeah.
So were you able to complete that?
I was, yeah.
All right. Can I see it?
Yes.
Thank you. All right. Let's take a look at this. So it looks like that he had more tantrums on Tuesdays and Thursdays. He had 5 tantrums on those days. They're more so than the other days. Can you kind of tell me a little bit about what was going on those days?
Yeah, so I noticed that too. And Tuesdays and Thursdays, I didn't really think about it, but we have a lot more activities planned.
Mm-hmm.
So he has like soccer practice and like Boy Scouts. So, yeah, I had never really thought about that and how that kind of tied together, but I do think maybe that's it. I noticed that there was definitely more on those 2 days.
Okay.
Yeah.
All right. Thanks for explaining that. And it really seems that this tool really helped you kind of see what types of things could be triggering his behavior. So and it looks like those transitions and those busy schedules can be one of his triggers as well.
Yeah. Yeah. It was definitely helpful to see that and kind of see if maybe, like, if I do change our schedule a little bit, if that changes.
Okay.
Yeah.
Have you been seeing anything else, any other behaviors that kind of arise?
No, just that same tantruming, and I think they happen more the more tired he is. Like, it can be over 5 times a day if it's a day where he's just more tired and doesn't have as much downtime or doesn't have as much energy. Yeah.
All right. So thank you for completing this as well. I know your schedule is very busy, so thank you for completing this and showing it to me. So I also want to talk about the observation that I was able to conduct last session, and thank you for allowing me to come into your home and kind of see you and Andrew's interactions together. And it looked like you guys have a great bond. He kind of looked to you for like comfort, and he asked you a lot of questions. So that was really great to see, and it looks like you guys just get along well if he's, not tantruming. So at cleanup time, I did observe, you did tell him to put his toys in the bin, and you asked him about 6 times, and he just kind of ignored you and told you no, and I could tell you were getting frustrated, and your voice got a little bit louder, and it just got to the point where you just put the toys in the bin yourself. Is that something that normally happens?
Yeah, I didn't really realize I asked him that many times, so that's good to know. But yeah, that's typical, like, especially with cleanup, I just can't get him to clean up. Like, maybe he'll put one thing away, and other than that, he'll yell no or just ignore me. And so, yeah, I guess I've just started cleaning up myself after I've asked a couple times. I guess I think, like, well, I asked, so now to get it done, I have to do it.
So I kind of want to put everything together, and just according to the observation that I conducted and the assessments really kind of went together with what I observed during the observation and what you've been telling me about his behaviors. And it just seems that, his tantruming is pretty frequent throughout the day, and he struggles kind of to regulate himself in those tantrums. So he'll yell and throw things and kind of just not listen to you, and that's a stressor for you, especially because you have a busy schedule and you're trying to get things done.
Yeah.
And that sounds correct?
It does, yeah. I think, I definitely feel that pressure, like when I need him to do things, and I probably feel that pressure more when it's a day where we have more on our schedule, like Tuesday and Thursday, and so he's feeling drained and tired, and I'm feeling pressure, and that's kind of how it's ending up.
And that can be understandable that you're on this time constraint.
Yeah.
You're trying to get things done, and then the stress comes, and at that point, that's why you're kind of inconsistent with your discipline, because you have a lot of things to do, and you just want to get things done.
Yep, yeah, I've just started to do them for him and become a bit more relaxed on, like, having him do it.
Okay.
Yeah.
So, so moving forward, I kind of want to look into those issues and kind of make some goals for change.
Okay.
And you mentioned that you were ready to learn some new discipline strategies to utilize during these challenging times.
Yeah.
So hopefully Triple P can give you some skills that you can kind of start planning for those times when they come before they come. So kind of like setting clear expectations for him and kind of following through with those, and trying to continue to use a calm, clear voice when talking to him, and hopefully that can promote some of those desirable behaviors that you're looking for.
Okay, that sounds great.
All right, so now I'm going to evaluate myself on Competency 1. I think I did a good job of explaining each assessment. I think with my summary, I can give a little bit more feedback to you. And just kind of putting everything together. That's better.
Great job.